I think we have to be in an environment where there is a concept of wellness-centred leadership, where we're able to build a community of people and build leaders who are able to sustain others. And in actual fact, I think many of these leadership skills are the same leadership skills we've been talking about for decades, but it's ultimately about connecting with individuals and understanding them and valuing them and helping them to do their best work.
I'm Dr. Louise Messara, and this is the Future Health Podcast. Lots of smart people spend a lot of time talking about the future of work and the critical role of workforce wellbeing. Today, we're going to examine some of the organisational and individual capabilities our health leaders will need to cultivate to establish a well workforce and explore what it might be like to work in that future. How might it feel? Who's in charge? What jobs are we doing? Are we empowered and engaged? To help us paint a picture, we'll be speaking with Dr. Sarah Dalton. Sarah has a clinical background as a paediatric emergency physician and a long history in medical leadership, including as president of the Paediatrics and Child Health Division of the College of Physicians, and she holds a number of executive leadership roles within New South Wales Health. Sarah has completed a Fulbright Scholarship in clinical leadership, and she's also an executive coach and facilitator, working primarily with healthcare leaders. Sarah, we should probably start off with a bit of a definition. We're going to talk a little bit about workforce wellbeing. When we're talking about that, what does it mean to you?
I think that's just the best question, Louise, and I think everyone would have a different definition in the same way that we've had long conversations about what is good leadership and what is good culture. I think it's a very similar question. What does wellbeing look like? And in the same way with the other two, I think in some ways it's hard to define, but you know it when you see it.
It feels like it's growing in momentum, just this phrase, workforce wellbeing. What would be some of the drivers, do you think, behind this movement now?
I think there's a lot of reasons why we're thinking about it now. And I think COVID has accelerated all of it. And I know we've talked a lot about COVID. We probably won't talk too much more about it now in detail, but I think it's just fueled the fire for everything we're talking about with wellbeing.
So if we think about some of the essential pillars of wellbeing, what are we thinking about?
I like to think about flourishing instead of wellbeing. I know there's a lot of conversations about the right word. People will talk about the difference between wellbeing or the opposite of burnout or flourishing. There's a saying from Tate Shannonfeld, who's one of the leaders of the wellbeing leadership space, which is the concept of professional fulfillment. So I do think there's a difference, although they're absolutely related, between wellbeing at work and wellbeing at home.
Or what do we know about the sort of leadership that the future of healthcare is going to demand when we think about this sort of well workforce?
I think the future workforce is one where we absolutely need to be doing everything we can to attract and retain and sustain staff in healthcare. We know we're struggling to get people in healthcare. We know that systems across the world are struggling to have an adequate workforce to meet the needs of healthcare. And there's a lot of reasons for that, multiple reasons for that. But one of them is that sometimes healthcare can feel like a really difficult place to work, particularly where we have demands that feel like they're outstripping the resources that we have. And people are going to work with purpose and meaning, wanting to help other people and to do their best work. But it feels sometimes like we're constrained in a system which doesn't allow us to do that. So I think we have to be in an environment where we're building leaders, and there is a concept of wellness-centred leadership, where we're able to build a community of people and build leaders who are able to sustain others. And in actual fact, I think many of these leadership skills are the same leadership skills we've been talking about for decades, but it's ultimately about connecting with individuals and understanding them and valuing them and helping them to do their best work.
I was going to ask, do you think a good leader is a good leader in every environment?
I think that's right. In fact, one of the more recent articles I read from Tate looked at all the different models of leadership over the last few decades, and they all do come down to those fundamental important things. You have to understand yourself and lead yourself. You have to understand others and lead others, and ultimately remember that we are a role model and that one of our jobs is to inspire change. And you can't do that without understanding people and really supporting and working with people.
So as a leader yourself within the healthcare, both in sort of administrative and clinical worlds, what strategies are you personally employing to help create the environment that we're talking about trying to create here?
There's a really interesting piece of work from AMA Steps Forward. And if people haven't looked at it, they've got a lot of work about how to build relationships and workplaces where people thrive. And this is the American Medical Association. And I don't normally use a lot of frameworks and reference them in detail, but I would like to reference the 5 steps of the AMA Wellbeing Leadership Playbook, because I do think that they summarise really what we all need to do as leaders. The first step is to include people. And that means making people feel valued and making sure they're part of a conversation and making them feel like they're part of a community. And we definitely know that being part of a community is a really important part of feeling like you belong at work, that you're part of something. The next step is to inform. And so really that's about communication and transparent and being open and telling people what you're doing. The next one is inquire, and that means ask how people are, ask questions and seek feedback. And I think that's not something that we're really good at in healthcare. And then the last couple are develop people and recognise their skills. And I also think that's something that we're not always good at. We're very time poor, and obviously we're all trying to meet lots of different deadlines and important markers that are really not stopping in our healthcare system, because the doors are always open and we're always doing something. But remembering to stop and think about what your professional development needs are, and to be able to invest in somebody else to help them develop, and that also helps them feel valued.
I think it's really interesting when we talk about sort of the issue of feedback. I think we do a lot of, as more senior people in health, training ourselves to give good feedback. But it's interesting that you say we might not be so great at the receiving of feedback ourselves. You're a coach as well, as one of the many other things that you do. How do you help people in leadership roles really have the humility to sit and really take on positive feedback from wherever it might come?
That's a really good question. And I think that receiving feedback, there's a whole literature around being feedback ready, which I'm not going to go into detail about now, but it is about accepting feedback in a way that is designed to support and improve you. So I actually work with clinical leaders with 360s and having feedback from other people. And they're always people that they have chosen and people in their teams, but it's anonymised. So you know that you've invited 15 people to complete feedback and you know who the 15 people are, but you don't know individually what everybody has said. And so we always talk about the fact that you seek feedback from people who you trust and people whose feedback you will value, but at the same time, people who will be able to give you a level of constructive critique, which will give you an opportunity to improve. And it's all about being in the right headspace to receive it, but being willing to look at it as a piece of information to decide how you will manage it. Because I think many of us receive feedback, and when we say feedback, we mean negative feedback. And I think we have to remember there's also positive feedback. It's really important to focus on that. But when you have received some feedback, it is a piece of information and you have an opportunity to process that as you wish. It doesn't mean that it's right, and it doesn't mean that you have to react to it. But I think you should review feedback and consider that insofar as working out what is it that I will accept and what is it that I want to change, and to remember that it's been delivered in a spirit of support. There's a quality improvement saying, which is every defect is a treasure. And I love it because it basically says if you can find out where the soft spots are, then you can do something to improve it.
If we think about sort of wellness-centered leader as being really an accommodation of many leadership styles that have existed over time, are there specific individual capabilities which are new, different, or we really need to prioritise in a different way in this particular framework?
I think that one of the big takeaways for me is the importance of listening. And again, there's a lot written about listening, but the concept, particularly for people in leadership roles, no matter what field they're from, but certainly in healthcare, we give a lot of advice in healthcare. And as leaders, I think the more senior we get, the more we're expected to tell people what to do. And that's also, I guess, a form of hierarchical or authoritarian leadership, is to tell people what to do. And to be fair, there's times in command and control where you have to do that. It's not to suggest any leadership style is right or wrong, but in looking at ways of bringing people on board, helping them feel valued, helping them do their best work, we have to remember that the people who can do the work the best and who understand how to improve it are the people doing the work. And the concept of engaging with the frontline, I hate the word frontline because it makes it sound so much like a war, and I don't think that's the right analogy for us. But I do think that the people who are actually at the very front edge of the work that's being done are the people who can understand it. And there's actually a work around complex adaptive systems that says that no one solution will work, and the people who are most likely to find it are the people working at the front line. So I won't know that as a leader unless I ask.
Yep.
And so I absolutely think that one of the key things leaders need to do that we don't do enough of, because it might feel like it takes a little bit more time, is learning to ask, not tell.
I think at the very start you said we sort of will know it when we see it, or we know it maybe when we feel it around sort of wellness centred institutions. Are there specific organisational markers that can help us identify a place that's doing this well?
There are a lot of different markers. Like everything, I don't think there's one true way or one right way. I think in principle, measuring something is the place to start, because you can only improve what you measure. You manage what you measure, as they say. So in some ways, it probably doesn't matter so much what you measure. It matters that you're watching it, you're monitoring it, and more than anything, you're responding to it. Broadly speaking, you can measure individual well-being, and there are tools for that. There's a well-being index, for example, in healthcare, which is widely adopted and is a really good validated measure of well-being for individuals. And you can measure organisational measures. And obviously in New South Wales Health, there's a number of different ways of measuring staff experience. At the end of the day, I think these things are a little bit like taking a temperature. Like you get a number, you get an idea, and it's about how you respond to that and how you track it over time. Mm-hmm. That makes a difference.
Mm-hmm. We know that the skills of our managers and our leaders can really have a maybe singular impact on the well-being of the team that they might lead. Are there specific new initiatives that we need to consider when we're thinking about how to support our leaders and managers to really be their best?
You've already mentioned that I'm a coach, and so I do have to say that I learned coaching skills because I wanted to develop leadership skills. And that's actually the way that I see we can become better leaders. You can call coaching skills lots of different things, and you can call leadership lots of different things, but the healthy, thriving organisational culture is one where leaders are listening, leaders are asking people for solutions, leaders are supporting people to make change, leaders believe in their teams, and leaders are showing a way forward and moving obstacles so that others can get there. And I think that approach is really important. As I said, it's not the style for every conversation, but in general, if you have a team where you can see a leader sitting down and talking to individuals and asking them about their experience, and advocacy with inquiry, trying to understand why it is that you came to this position and why have you chosen to do it this way and what has gone before jumping into solutions and telling people what to do, it really makes a difference, because it not only unlocks the best solutions, but it means that people feel valued and respected and like they're contributing. And I think that those things make a big difference to individual performance and team performance, because it builds trust. And I think at the base of all of this is the importance of trust.
There's some good evidence about the relationship between workforce wellbeing and quality care. But there's also a big gap, or often a delay, between innovation and adoption. So we know a thing is good for the system, or we know a thing is good for us, and it still takes us some time to get there. Do you see pockets of resistance to this type of work or this type of approach to organisational wellbeing and leadership, or do you feel like the winds are with us?
Can I say both?
Yeah, you can say both.
You know, I think the winds are with us. I think everybody wants a workforce that is well. Everybody wants to be well. We all want to thrive, and we all want to see a highly successful healthcare system. So we're all pulling in the same direction, but we sometimes have different ways of going about it, different beliefs in what's going to work, and potentially different understanding of different words. So we haven't talked about it yet, but sometimes even the word well-being is something that people have resistance to, in the same way that we've had resistance to the word resistance and,
resilience.
In the way, resilience, that's right.
Yeah.
And also flourishing, I was thinking. I mean, I don't love the word flourishing. I've been in a number of conversations where people have been trying to think of what is the right word. And professional fulfillment is probably as close as we've got to the concept that you can go to work and really feel like you're doing your best work.
I mean, professional fulfillment, let's go into that a little bit. I think that, we've talked about professional fulfillment or mentioned it, and we've talked a little bit about the importance of job satisfaction. And, we are a privileged group of people who get to work steeped in theoretical purpose and meaning, which is a huge advantage. But we are also time poor, stretched, stressed. I wonder a little bit about how we can help to protect our people to be able to access that purpose and meaning, and if there are particular ways in which we can give them access to the restorative parts of the job. We work with people, we care for people, there is joy to be had, there is happiness, there is fun, there is connection. How can we make sure there's a good balance between the hard part of our work and the joyful part of our work?
I think it's absolutely up to all of us in different ways. And those who are in system leadership roles, it's all about improving the system. And the reason that's easy to say is because that's obvious, but it's extremely hard to do. And that's coming back to your previous conversation about resistance. I think that's why this is really hard, because ultimately we'd all like to go to work where we've got the right numbers of clinicians for the number of patients, and we've got the right number of theatres open, and we've got the right number of beds, and we don't have ambulances ramping up. If we could work in that environment, I don't think we'd be having such a conversation about wellbeing, because we would feel like we were able to meet our meaning and purpose. That concept of moral injury, where you're unable to meet what you think is your meaning and purpose, is the situation that we're all working in, because there's a limited number of funds available to provide healthcare, and therefore we can't always do what we want to do. That makes it very difficult for people to show up and feel joyful when they can't do their best work. At the same time, I think there are things that we can all do. So with a systems perspective, the answer is everything that we've talked about around quality improvement and system effectiveness and efficiency. And there's a bunch of stuff organisations do every day to try and optimise that. We're all thinking about that already. As an individual, it comes down to what can you control. And sometimes it feels like there's not a lot you can control. But as a very simple exercise, stopping to think about, why did I choose this? Why did I decide to become a paediatric emergency doctor? What was the original thing that I loved about my work? And, for me, I just really enjoy the interaction with children, because they're just so pure and fun, and, terrible things happen, but they get over it. And I love working with people who work in that environment. And so on days where I've been struggling to find a reason to feel joyful about work, I've reflected at the end of the day, where were those moments? Where were the small things that happened? If I can't change the big things, I can't change the ambulances, I can't change the fact that there's no retrieval services active in New South Wales today, but in the individual interaction that I have, either with the child in my case, or the family, or even working with my colleagues or doing some teaching, if you can find even 20% of your day, or even less, just moments in the day that you can really reflect on and find joy and purpose and meaning, and, the words that are big words, then bringing them to awareness and having the opportunity to appreciate that, and having that as a conscious part of your day, can make things a little bit easier, even though it might not change the system.
We're in an interesting quandary in health. We know that an important part of all of our work satisfaction is recognition. It's being valued, as you've said. It's a big piece for a lot of people. Autonomy, you've touched on that sense of control or lack of control in a big, that we're a cog in a wheel. If you or I had worked hard, trained, and we were at a commensurate level in many other fields, there'd be very specific, well-trodden paths for recognition and value around remuneration and bonuses and other techniques that other industries have that we are constrained by here. But we do need to find ways to express our recognition for the effort and work of all of the people that work in healthcare. Have you come across in your many varied journeys and travels, other places that have been a bit more creative perhaps about ways in which they can really make their team feel valued, given that we really just don't have all the levers and tools that other organisations or institutions might have?
I think it comes back to authentic positive feedback. And if you stop and think about the last couple of times you've stopped someone to say, can I give you some feedback? My guess is, first of all, you haven't. And secondly, if you have, or if you've even thought about it, it's probably been negative. And so I often find myself in conversations where someone will say to me, this person was amazing today. They did this great thing. And I'll say, did you tell them? Oh, no, I didn't really get around to that. One of the programs that comes to mind is a UK-based program called Learning from Excellence. And they have a whole system which is designed to capture positive feedback. And it can be a written note, or some places use online notes. But for those little things where you notice, even little things like thanks for getting me a cup of tea this morning, or big things like the way you broke that bad news was awesome, they capture it anonymously, and that becomes as much of part of the feedback that they get in the organisation as anything else. And I really think that we need to move in healthcare towards strengths-based approach, and not only looking at where things went wrong but where they went right, and not only giving negative feedback but giving positive feedback. And I think we need to formalise that positive feedback loop so much more than we do. And it's an individual challenge. Even if each of us just once a week found one person who'd done something amazing and told them,
just make time for that.
It makes a difference.
Yeah. I was at the Cleveland Clinic at one point, and they were running a program where they were interviewing people in outpatients as they left a clinical consultant interaction and asking for feedback. And they were then publishing on the internal tea room TVs the positive feedback, anonymised, but detailing the clinician's name. And that was extremely impactful in reinforcing some of the specific behaviours they were hoping to reinforce, which was around good communication, eye contact, all the things that you'd like to think are happening. But it was just such a small thing and such a boost actually to people's experience of their day.
I heard one of the AMA Steps Forward leaders speaking about this. He's a doctor, and he said that as part of his onboarding and orientation of new team members, one of the questions he asks them is, how would you like me to give you positive feedback? Would you like me to do it in front of everybody so that everybody knows? Because some people love that.
Yeah.
Some people hate that.
Sure.
Would you like me to send you a text message? Would you like me to send you an email? And even the fact that you're asking, I think as a leader, these signals are so important to our teams about what matters to us. And so asking the question at the very beginning signals that that's a big part of your leadership style. You then have to follow up on it. You can't ask it and not do it. But genuinely showing that that's a priority and then acting on it and doing it in a way that is right for the person. Like personally, I would hate someone to praise me in a big public environment.
I won't thank you at the end of this.
Don't thank me. No. I'm here because I care.
Yeah.
But I occasionally would love to get a text message, especially if it was something where I hadn't realised it made an impact and somebody said that was great.
Yeah.
I think those things, little things, can make a difference.
We spend a lot of time at work, a lot of time with our work colleagues. And what I've come across in health is the extraordinary other skills and experiences and interests that the people that I work with have, whether that's, an Amos in piano, or a lot of our colleagues now have come to health in a postgraduate way, so have had entirely different careers. Do you think we're doing a good job at really harnessing the whole of the people that we are working with? I feel like there's a real untapped talent pool when we just sort of look at a person, know their rank and grade and their clinical specialty, and that's sort of where it ends.
And I think that's another great opportunity for a leader when you're learning to work with someone new, and whether you onboard them into your team or whatever you do, or even as an individual when you're working as a peer with someone, being able to talk to them about what is it that you love, that you're really passionate about, and that you do, that you might be able to do more of in this job. There is actually some work again from Stanford which shows that in any job, if people can spend at least 20% of their time doing something that they really love, then they won't be burnt out, even if the other 4 days a week are really rough. So I think if you can have a conversation about how to tap into what you're really passionate about, because not only is that person then going to be more fulfilled and a better team member. But you're tapping into that skill set as well. And if they're passionate about it, they're probably good at it. If they're offering it up as something as a skill for the team, it'll probably benefit the team, it'll benefit the patients, it'll benefit the system. I do think we need to take the blinkers off and look a little bit beyond what we're used to.
I don't know how comfortable you are with the word burnout. We can call it many things, but maybe it's reasonable to think about the rate of change and the impact of constant change as a stressor on the worker. And, we're talking here a lot about future health technology, and sometimes you talk to people on the front edge. Is that what we're calling it? Not the front lines, front edge. And, there can be a real sense that there's just this tsunami of change. And sometimes I think it feels for people that it's change for change's sake. We may feel like we're in a loop of change without genuine forward momentum sometimes. Do you ever worry that the health system is a bit stuck in this loop of implementation? I think sometimes we're good at starting things. We don't seem to be great at ending things. I just wonder what you think about how we might really maximise momentum around initiatives that really make a difference for the workforce and for the patient, and maybe drop off some of the things that are a noise.
The first thing going through my mind is not all change is improvement, but all improvement takes change.
Okay.
So I think it's a quandary where we do have to be in a position where we change, and it's difficult. It's not innate for most people to change. At the same time, there's a lot of, I wouldn't say change for change's sake, because I think there are people behind every change who are working to improve something. Mm-hmm. But I agree that we sometimes don't stop and think whether this is having a positive or negative impact. We don't evaluate it soon enough, and then we don't disinvest if it's not working.
We're not great at failing fast and reconsidering our position. It's like we're in it, we're barreling along. Other industries do this well. There's a space for creativity, trying something, evaluating it and discarding it. We don't seem to be that sophisticated at that yet.
Look, I think that's a fair call. There are places like innovation hubs and accelerators and incubators and lots of places in healthcare that are thinking about this and doing a great job. I also think at the same time, we're talking about one of the biggest industries, and we care about people, but we also have a responsibility for safety, and we have to maintain a low-risk environment. And I find sometimes the analogies between healthcare and aviation are very limited. But if you were going to fly with an airline that said we fail fast, I'm not sure that I'd want to get on that plane. So I think there is something about risk appetite, but I also agree that there's a lot more we could do to be better at change.
I was listening to you talk with Cheryl Martin on her podcast, Mindful Medic, which I recommend everybody have a good listen to. And you and she were playing in a space of the Royal Utopia Hospital. And this was a place where we've jumped forward now and we've implemented a number of these plans and proposals and frameworks. And I wanted to talk to you a little bit about how it might, we can step through how we might get there, but how it might actually feel to be a worker in that space, in that place where we've made our way. And I want to talk a little bit about maybe not only how it feels, but who's in charge? What does the executive team look like if it looks different to today? Are we being given different tasks as clinicians? Are we being paid for different things that we now do as add-ons to our jobs? Just a little bit more about the nuts and bolts of what it would be like to be an active participant in this utopian environment. So if we start with, to get to there from where we are here, if you could pick 3 big changes that we would need to make across the board to get us there, what would be maybe 3 of your top strategies?
I think the things that go through my mind are engaging with the frontline, and I'll say that word again, finding a way to invest in leadership. And I say that in knowing that healthcare has tried to invest and prioritise in leadership for a long time. And the last one would be finding ways to build community. And what that looks like is very different in different places, but a great example of engaging the frontline in terms of trying to solve the problem with the people You would have heard on the podcast a conversation about the JMO manifesto and the way that the JMO rosters have been designed in Western Australia. And I'm not close to the details of the work, and there's more information if people are interested available online. But essentially, they sat down with the hospital executive and the medical leadership team and the junior doctors, and they just solved the problem together about rostering. And they said, we understand it's hard, we understand we need 24/7 coverage, but we also understand that people need to have guaranteed time off, and there needs to be leave that you can plan ahead, and you need to have some autonomy and control over what you do. How can we solve this together? So I think that example of bringing the people who are living the problem into the solution, really surprisingly, no, the people who were in the problem, the JMOs, they didn't say, well, that's unreasonable, you can't staff the hospital 24/7, or that's unreasonable, we should all be on holiday at the same time. Like, people understand the constraints of the system, and we have to respect people and trust that they will bring reasonable solutions, not just be demanding and make it difficult for us. So I think the first one is, if I was working in an amazing hospital, and many hospitals do this, let's be clear about that, there would be opportunities for people who are doing the day-to-day frontline work to be part of solutions and to suggest, but then also to take action and to provide feedback and to call it early if it's not working. So I think that empowerment of people in the frontline is really important.
Do we need to find a way to draw a line and restart or reset the relationship between clinicians and administrators? Because it feels like, and often they're the same. We can often have clinicians who are also administrators, but it feels like there's an unnatural and unnecessary tension between these groups that are, as you say, all reasonable people who get up in the morning and come to work to provide great health services to the community. But it's almost as if sometimes they're on different sides of the team. Do we need just to draw a line and let's all put the same shirt on and realise we're all part of the same team? Why do you think it's ended up in this sort of tension?
I'm smiling because it reminds me of the Garling report, which some people listening will probably never heard of, and other people may well have been part of it and trying to action it ever since. I think it was the late 2000s, and Garling was a emeritus judge who had an inquiry into New South Wales Health, and it'd be interesting to go back and look at his recommendations for many reasons. But he talked about the great schism between clinicians and administration. And so I don't think this is an unusual or new concept.
No.
And I think it's a human concept. We always have us and them. We always have our tribes. We talked about the importance of belonging as a human need. And so we find the people we belong with. And if you identify as a clinician, then you're a clinician. And if you identify as a manager or a leader, then you might feel like you're part of that camp. There are lots of people like me and other people on your podcast and yourself who have a foot in both camps. And I think, again, there's no easy solution, but being able to walk a mile in my shoes, like being able to imagine, if you're a chief executive, to be able to imagine what it's like doing a night shift in ED when there's 50% of staff have called in sick. Or even better, to walk into ED at midnight and check in how the team's going. And there are chief executives who do that. Or if you're at the front line and you're doing the night shift and there's no one else with you, imagine the poor person who's tried calling around to get someone to come in, and the hospital administration who can't recruit staff. And think about the fact that they've been doing these recruitment drives and they've been doing everything they can to bring into the staff room, and there's nothing happening. So we are all trying, and I think it behooves us all well to step for a second into the other person's shoes and to imagine what it would be like. And that way we can get a little bit closer.
So I suppose that, who's going to be in charge in our Royal Utopia Hospital? Is that even the right question to ask? Maybe it's not who's in charge, but how are we all collaborating to lead? Because everybody is doing an important role. Everybody's job can't be done by the next person in health. And it's quite unique that really it's, everybody has their own specific lane. Do you think that a chief executive, that's the right model for leadership of a health institution?
There always has to be someone accountable. There always has to be someone in charge. We need governance structures. We need escalation pathways. We need decision makers. So I don't think for a minute that we could have a system without some central connection and governance. And I think the people who are in those roles who do them well have that delegated authority, collective leadership style where they work in tandem with their teams and they push out and delegate and authorise others to take as much control as they can and to solve the problems that they can themselves and only escalate when there are issues. There's a concept called collective leadership, and again, there's so many different models for leadership, but this was something that Michael West from the King's Fund talked about a few years ago. And it's the same kind of concept, which is that everybody has their role. We all work together. We do our best work if we're working alongside each other. It's a flattened structure. And it really is about making sure that we are all working together and pulling in the same direction. And one of the great sayings of leadership that I enjoy is that as a great leader, your job is to surround yourself with great people and get out of their way. But I think you have to add to that at the same time as knowing that we're all going in the same direction. Can't just surround yourself with people who are wonderful and then let them do their own thing. And I think if we didn't have a chief executive, if we didn't have someone in charge, then there wouldn't be that alignment. But I think the role is about vision and mission and purpose as much as it is about telling people what to do.
Would we have any new roles in hospital executive in this sort of future environment? I think a bit about all the tasks and jobs that leaders within hospitals are asked to do, as well as, is there room for completely dedicated resource in new areas that we haven't conceived of at this stage?
So the Chief Wellbeing Officer is a role that is really under development at the moment, very well developed globally, but not so much yet in Australia. And I think that people who are expert in this space will say that it's so important to have that visibility of leadership. And I do think for a number of roles that are on executives and in leadership positions, it really changes the conversation because that person or that perspective is at the table. You could say same things about patient leaders or clinical leaders or other groups who have important roles to play and voices to be heard in this space. So I think that if you're really asking me about what a great future would look like, paradoxically, I don't think there would be a Chief Wellbeing Officer because we wouldn't need to give it that much visibility and that much prominence anymore. Let's imagine that we're now 10 years down the track and, this is utopia. We've fixed everything and the teams that we work with are enabled by all sorts of things to be really effective and work at the top of their game and they're flourishing in their roles. If we get to that point, we don't need a Chief Wellbeing Officer anymore because it's everybody's job and it becomes just business as usual. But when you're raising profile and you're on the front end of the curve and you're changing the way people think, then I do think visibility of those positions is important.
I agree. And I think if a chief executive has invested in a resource like that, it really sends a signal to staff where their priorities are. And, it's one thing to say something is a priority, but if it's backed by dedicated resource, I think it comes with a lot more credibility. So I agree with you there. Do you think technology is going to free us in some ways to create space for that reconnection to purpose and meaning that we've talked about before? I mean, that's one of the exciting elements of what's coming, I think.
I don't think we know exactly what it will look like, but I absolutely agree that technology will change what we do and it will enable so much of what we do to be better. I don't think it'll be perfect. And the whole question of AI and how that changes how we work is a really live question. But ultimately, what we know about people flourishing in their work is that they're able to work at the top of their game or at their top of scope of practice, that they're able to do the work that they really are trained best for. And the more they can work in that space, it's tiring, but it's very rewarding. And digitisation will remove a lot of what appear at the moment to be mundane admin technical tasks, which will give us time to work in the space that we're trained to work in. I also think that it will give us an opportunity to work more with human connection because we won't need to spend quite so much time learning about, the 10 differentials of hypoglycemia because we will have some AI suggestion or clinical decision rule that will help us know what order set to do. And that will give us time to connect to our patients, to talk to the families, to understand that human connection and to bring what I think is one of the most important parts of healthcare, which is being able to be there with our patients and support them on their journey.
So if we've solved for wellbeing, really the next frontier is that connectedness. We've created space and time for all of our clinical workforce to be back at the bedside, connected to their patients, connected to their colleagues. It's exciting about what will become our focus in that time and space.
And that is coming back to your very first question of what is the definition of wellbeing.
Well, then I think we're done. Sarah, thank you so much for your time today. So many interesting insights. I really appreciate it.
Thanks very much, Louise.